What if you could actually connect with your loved one, even if their memory is fading? I know that communication is one of the hardest parts for caregivers. In this video, you'll learn why traditional communication fails, and you'll learn proven tips that improve communication. Let's talk about why traditional methods fail. Most of us are taught to communicate using logic, memory, and shared understanding of time, places, and facts. We do this every day. How was your dinner last night? When is your next meeting? But dementia affects language processing and memory, making it difficult to access events from the past and connect sequences of time or logic. This means your loved one may not understand what you're saying, or they may not retain the question that you asked. They may not just be ignoring you. Normal conversations that include time, logic, open-ended questions, they can be really troubling for them. Here are 3 proven communication tips. 1, use simple, direct language. So one-step commands, simple sentences. When possible, if you're asking a question, try to phrase it in a way that requires your loved one to simply answer yes or no. So really chunking that conversation down into simple one-step commands is going to be really helpful. 2 is your tone and your body language. So first, always approach your loved one from the front. In other videos, we talk about peripheral vision loss that happens with those who have dementia. So making sure you're approaching them from the front in a relaxed manner with a smile and a nice tone to your voice will really help calm the situation. And when you make eye contact with your loved one, you are developing that sense of trust and security. So keep that in mind, and your mood can really be contagious along with your presentation, the way that you're approaching them. And 3 is validate before you redirect. So before you try to transition to another topic of conversation or maybe to another task or activity, you really do want to acknowledge what your loved one is going through and what they're experiencing, especially if they're upset. So you could say something like, I see you're upset, let's talk about it, right? So always validating first what it is that they are experiencing, hearing them out, and then moving on to a distraction technique. Now let's talk about what you don't want to say, because this is really going to be part of your effective communication. Sometimes what we don't say has a great impact. So you certainly do not want to argue, right? You're not going to win. This isn't a competition. Arguing is just going to escalate the situation. And you don't want to correct your loved one either. There are going to be times when they say something that is not accurate, but to them it is. So if you correct them or point that out, it really can cause an array of emotions for them. They could be embarrassed. They could get anxious. They might even be agitated if you're correcting them. Quizzing them. You don't want to say things like, do you remember? Right? Because asking someone with a memory impairment to remember can be really hard for them. So you don't want to say, do you remember what you ate for breakfast? Or do you remember who I am? Instead, you just want to simply restate what it is that you want to get across. So if you want to talk about what you did yesterday and the likelihood is that they may not remember, you can simply state, we had a great time at dinner last night with Rob. And, you just want to continue the conversation that way. Learning how to effectively communicate and engage in conversation with your loved one who has dementia, it is a skill. It sometimes feels like you're learning a whole new language, and that's okay. You don't have to get it perfect every time, but with practice and patience, it will improve. So I want to share a story that has to do with communication. I was working with a daughter, and her mother had Alzheimer's disease, and she was trying to communicate to her mom that she couldn't wear this particular sweater because she'd been wearing it and it was dirty, and now the weather was getting warmer and it wasn't appropriate for the temperature outside. And so I said to her, "Did you ever ask your mom why that sweater is so important to her?" And she said, "Yeah, my dad gave it to her and he passed away." So instead of getting into an argument about, you have to change your shirt, your sweater, it's dirty, I just recommended that she buy some other tops in the same color so that her mom still has that connection to her spouse who's no longer here, but she's wearing clean clothes and it's more appropriate for the weather. So that's just a quick tip on communication. Make sure that you subscribe to my channel if you want other content that is real and nurse led that will help you navigate through your dementia journey. And also, please comment below some tricks that have worked for you when communicating with your loved one. And also let me know if you're struggling with any type of communication right now. I do read every comment, and so I will respond there. And as we share, it helps others in the journey as well because we all learn from one another. So until then, I'll see you in the next video.